we are going to move on to our final panel. And so as we're swapping out the people, I want to let you know that our final panel is the one where we're going to talk about lessons that have been learned from other contexts of use. We've got two speakers. The first is Gil Alterovitz, who's the director of the VA's National Artificial Intelligence Institute. And then we also have Atul Butte, who's the director of the Baker Computational Health Sciences Institute and the chief data scientist for University of California Health. So Dr. Alterovitz.
Well, great. It's great to see everybody here while we're loading up the slides. A lot of familiar faces, a few new faces as usual, I guess. But thank you to the National Academies for hosting us in this really great setting. So great, thanks. Looks like we've got the slides loaded. So yeah, I'm Gil Alterovitz, director of the National Artificial Intelligence Institute at the VA, and also the VA responsible AI official. It's great to be here, and we're going to talk about precision oncology and Veterans Affairs medical centers. And then part of this, as was mentioned, then we'll have Dr. Atul Butte, and then we'll have questions toward the end there. So let's go on, if we can, to the next slide. Yeah, so just a quick agenda. We'll talk about the National AI Institute, AI at the VA, and then networks and cancer R&D at the VA. Let's go on to the next slide. And the next slide, thank you. So a little bit about, if you may not have heard, we're pretty new, just like 3 years old now, but scaling very quickly. And our goal or our vision is really to lead the way in trustworthy artificial intelligence. We are building a research, development, and training organization within the VA, and seeking to have an impact on global scale, thereby ensuring the health and well-being of our veterans. Oh, that's forward. Thank you. Okay, great. Thank you. All right. And so many times people think, or people ask, why AI at the VA? It's actually a question that led me to think about why I went to the VA after doing a couple of rounds in different locations as a White House Presidential Innovation Fellow, a non-political appointment where I got to look a little bit around in the Cancer Moonshot and things like that at NIH and some other places. And I realized that a lot of times, like for AI, the data is very important, right? And the VA is the largest integrated healthcare system in the country. It has over 9 million patients. It also has a kind of this mostly closed loop system. So it's both the provider, the payer. It has kind of different opportunities to build that technology in-house as well as work with vendors. And there's the clinicians. It actually has them as employees, right? So there's a large, in fact, the majority of U.S. doctors and nurses at one point at least at one point, are trained at the VA, many times through a fellowship or internship. So lots of opportunities, many types of data sets as well, and kind of a national reach. Actually, international, if you look at it. It's from the Caribbean to the Philippines at their medical centers. Let's go to the next slide. Oh, sorry. What I wanted to start with is that we have been building, there are these different networks that we've been building, right? So there are cancer networks around cancer care, but recently through the National AI Institute, we're also building an AI network to develop and specialize in different types of expertise areas. Our goal is to pilot, iterate, and scale, and by having different sites, and we start with 1, and now we're at 4, and it will expand, but is to have this diversity of talent, diversity of patient populations, and to continue to grow from that. There are a number of pilots that we're doing. I don't really have time to go into that too much. I wanted to focus in a little bit more on the networks and the cancer R&D at the VA, just to give you a feel for it and try to make it complementary to some of the things that you may have been hearing, right? So, one of the things is it is a kind of a large organization, right? It's the largest provider of oncology service in the country. So it's over 500,000 treated, and there is a larger percentage of cancer seen in veterans. So if you look at that, it is one of the priority areas within the VA. And what I wanted to focus on is kind of like that there are also these collaborations with organizations outside the VA. And in doing so, we're able to leverage and bring in a number of those technologies to help our veterans. So one of those examples is this public-private partnership between the VA and IBM. There are a number of them as part of the National Cancer Moonshot Initiative. We're now in version 2 of that. And, it primarily targets stage 4 patients that it may have exhausted other options. They've tried different options, they're not working. What else can they do? Well, in this case, through sequencing, they're looking at identifying mutations with AI so you can have more targeted treatments when other options have failed. And also allow for greater accessibility. More than a third of the patients actually have come from rural communities where deploying these cutting-edge treatments has been a challenge. But through this program, there's kind of an approach where they are reached out to as well. Just an example of a patient story. Army veteran Tom Hune was diagnosed with stage 4 metastatic lung cancer. And there are about 7,000 such veterans that have some type of lung cancer each year. And he experienced some severe side effects from kind of the traditional off-the-shelf chemotherapies that were prescribed. Through this collaboration, it revealed a mutation where a more targeted approach could be used by using an existing drug. So not some of there's other work going on, right, in making personalized treatments, but specific to an individual, but this was an existing drug that for kind of a class of individuals. That patient is an example success story here. As a national program director for oncology once said, interpretation is really the hard part. And so the use of AI tools can help bring knowledge and bring that focus. And so you can really focus on that individual's patient results. Let's go on to the next slide then. So another area that we have is AI-assisted colorectal cancer screening, where AI is used to detect precancerous polyps during colonoscopies. And colorectal cancer is another one of those high priority areas, especially in the VA. It's the second leading cause of cancer for men and women in the US as well. And this tool basically, for every 1% increase in the precancer polyp detection rate, it reduces the future risk of death by 5%. So if we can catch it, we can really make a big impact on outcomes. And this tool in current trials has been able to increase the rate by 14% during routine colonoscopies. I want to close by saying that all of these we have these different networks around them also by topic area, right? So there's for prostate cancer, there's also for lung cancer. So the Lung Precision Oncology Program is a network where there are 23 hub locations, each specializing and working on different parts, but working together to use data analytics to capture those results. And so that way you can assess what's going on and learn from each other in developing better protocols for the future. And as of May 2021, more than 5,000 had received molecular testing through LPOP through this relatively new program. So in summary, the VA is becoming a premier research organization with extensive data gathering and analytical capabilities. It does have the largest genomic database tied to medical records, depending how you count and define medical records in the world. And it's one of the largest repositories of medical images. It's 1 billion images per year, over 10 billion overall, and you can go back and get archived ones as well. And the VA, what it does is we're working to leverage this data and the power of different collaborations that are possible with individuals like in your organizations. So if any of you are potentially interested to work with the VA, feel free to reach out to us. I'll put the email on the next slide. And we have a number of different avenues for exploring this, whether it be AI tech sprints, where we have prizes that we give out, whether it be with VA investigators, where there are different grants, and whether it be actual contracts that that are out there. So I see my time is coming to a close, and which is perfect timing to leave you with the email. It's really just our acronym at va.gov, NIE@va.gov. We actually pronounce it NIE, kind of like Hawaii. And there's the website, and we do have an AI at VA community. And what that allows people to do is to kind of learn more about the VA, and thereby, if you do have an inquiry, you'll know kind of the kinds of topics that maybe we're focused on, and be able to have a more likely successful potential engagement. Yep, so we'll close there. And I think we're taking questions at the end, if I believe I have this right. So next, I'll pass it on to my colleague, Dr. Atul Butte, who we both had the pleasure, I think, of training together and interacting in many settings. So it's great to see you here in person. Great, thank you.